Hello, my name is Jesse Cardenas. This is my presentation related to the cognitive behavioral therapy roleplay. My client's name was Selena. Some of her target behaviors consisted of experiencing anxiousness. She said that she was feeling some type of anxiety. She said that she was self diagnosing herself with these symptoms. So we wanted to get some more clarity on that. And she was feeling overwhelmed due to a new occupation. I let her know and I reassured her that this could be common, as when we get overwhelmed, we have a lot of weight on our shoulders, causing us to have these negative emotions sometimes. She couldn't complete all her tasks as desired, and it makes sense when you can't complete all of the tasks that you need to complete to have a negative perception on yourself and have these negative emotions. She during the midst of all this anxiety and different negative behaviors, she was presenting negative self-talk and negative beliefs, constantly overthinking negatively. She gave me an example, for an instance where she would message somebody and they didn't message her. If they didn't message her right away, she would feel bad about it. She would think that the individual doesn't want to talk to her. So I assisted her in challenging that thought and trying to think in a positive way. For instance, maybe the individual might have been busy and might have wasn't able to respond right away. And that's common, scenarios as well. And these negative emotions and behavior was leading to a lack of sleep, where she mentioned that she was only sleeping 2 hours from the cause of these kinds of circumstances, um, which was very unfortunate as well. Cognitive behavioral therapy was founded by Aaron Beck. It was originally cognitive therapy, which derived in the 1960s and 1970s. Since that time, he and others have adapted this therapy to a diverse set of populations with a wide range of disorders and problems in many settings and formats. The cognitive formulation consists of the maladaptive beliefs, behavioral strategies, and maintaining factors that characterize a specific disorder. The figure on the right shows a pretty good description of cognitive behavioral therapy and what it emphasizes. So, for instance, for thoughts, what we think affects how we feel and act. Behaviors, what we do affects how we think and feel. And emotions, what we feel affects how we think and act. So as you can see, there's a pretty consistent cycle here. In our textbook, Cognitive Behavioral Therapy and Beyond, it gave a great description of this cognitive behavioral structure. It gave me a pretty good guide on how I would have to follow through with the processes. For instance, you would conduct a mood check. You would then go to the setting, the agenda. You would ask for an update, positive or negative, and review the action plans from the previous week. And then you would prioritize the agenda. The agenda, for instance, you would ask the individual, let's set the agenda. What would you like to focus on? What kind of issues are you experiencing? And then they would just go into what they would want to work on and then the various issues. And then you would be able to target different kinds of behaviors. So, for instance, you would work on the agenda item one, and then you would summarize, make interventions for the target behaviors, and then you would assess the needs for further interventions and discuss the action plan items. So, the action plan would be the interventions that you're going to present to them to assist on their targeted behaviors. You would work on the agenda items 2 and 3 if there's enough time, and then at the end of the session, you would summarize the session, review the action plan. For instance, the action plan is pretty much the therapy homework for them. So then you would review the action plan for the coming weeks, and then you would elicit feedback. These are some of the intervention techniques that I would want to emphasize within the session, which would be psychoeducation related to thinking errors that the client was presenting. The individual was saying that she was feeling a lot of anxiousness and self-diagnosing herself with anxiety. So I would definitely want to present her with some breathing techniques, which could make her heart rate go back to baseline when she feels overstimulated. She also mentioned that she was feeling overwhelmed with all the tasks at her job and tasks outside of her job. So I would definitely want I would definitely advise her to get a planner so that way she could schedule her days accordingly. Sometimes, well, most of the time when have our days lined up and in order, it makes our lives a lot less stressful. So then I noticed that she mentioned that due to the anxiety and due to the overwhelmingness of her day, she would have a lot of negative talk towards herself, lot of negative thinking, overthinking. So I would like to challenge her thoughts and replace them with positive ones, with positive reinforcement and positive self-talk, so that way she could reap the benefits of that. And then she mentioned that these symptoms and these negative target behaviors was influencing negative sleep quality. So I would definitely want to present her with a healthy sleep schedule, so it could kind of counteract her negative sleeping, and so that way she could get a full night's rest and feel positive and energetic throughout the day. These are some of the ways that I would be able to evaluate the effectiveness of the processes. I would like to monitor the client frequently and consistently, probably weekly if possible. And then I would have a symptom checklist where the individual could fill out a checklist before each session, presenting her symptoms and if any progress or declines are taking place. Monitor the progress towards their goals. So, are they reaching their goals? Are they coming close to their goals? Or are they going the opposite direction? I would elicit feedback, as feedback is very important between the social worker as well as the client. I could also present her with evidence-based self-reporting questionnaires. One of them that is very popular and very useful, and I noticed on the evidence-based articles that a lot of them use the EQ5D, which measures the health-related quality of life. And on the right, on the figure, it kind of gives a demonstration and a little brief description of what that might look like. This is the URL relating to the 6-minute video clip of the session. Unfortunately, it didn't let me add the video to the PowerPoint, so you could just copy the URL and just place it into your address bar. And then once you click on the video, on the YouTube video, you could gain some clarity of the session and how the processes went and took place. These are my references, and thank you for watching my presentation. I appreciate it.